Hello and welcome to our first topic this midterm, and we are going to talk about the abdomen. So, for lesson one, the topics are the osteology, structures of the anterolateral and posterior abdominal wall, and then the surface anatomy. At the end of this module, the students must be able to identify the bones of the abdominal wall, including the layers of the anterolateral abdominal wall, trace the distribution of the motor and sensory innervation of the abdominal wall, describe the structure of the posterior abdominal wall, utilize the regions and quadrants of the abdomen as a basis in determining the location of different organs, and identify the surface landmarks of the abdomen. So for osteology, as you can see, the abdominal skeleton consists of the lumbar vertebrae right here, the margin of the thoracic cage, wherein its components are most pertinent to the abdominal wall, and it includes, of course, the xiphoid process of the sternum, the costal margin, which consists of the costal cartilage of the seventh up to the 10th rib, and then the lower ribs. Next are the iliac and pubic bone elements of the pelvis right here. So here is the ilium, and then here is the pubis. So these abdominal skeleton have its own purposes, and it includes the attachment sites for abdominal wall muscles and limited support for the abdominal organs. Next, after the osteology, we'll discuss the layers of the abdominal wall. So from superficial to deep, we have first the skin, then the superficial fascia, the anterolateral muscles, the transverse fascia, extraperitoneal fascia, the parietal peritoneum. So these are, again, the skin, the superficial fascia, anterolateral muscles. We have here three layers: transverse fascia, extraperitoneal fascia, and lastly, we have the parietal peritoneum. So in the layers of the abdominal wall, for example, in the skin, we have here an image or the images of different types of umbilicus. So the umbilicus is a scar representing the site of attachment of the umbilical cord in the fetus. It is actually situated in the linea alba. Next is the superficial fascia. So as you can see, the superficial fascia is divided into a fatty layer called the Camper's fascia, and then the membranous layer called the Scarpa's fascia. So again, this part is your Camper's fascia. As you can see, there are a lot of yellow areas, and these are your fats, or which is definitely called the fatty layer. And then we have here the membranous layer right here, or the Scarpa's fascia. So take note again that the fatty layer or fascia of Camper or Camper's fascia is continuous with the superficial fat over the rest of the body and may be extremely thick. Take note, they may be extremely thick in obese patients. On the other hand, we have here the membranous layer or Scarpa's fascia, which is thin and fades out laterally and above becomes continuous with the superficial fascia of the back and the thorax. So that's for your Scarpa's fascia. After the superficial fascia, of course, we have the deep. Okay, so for the deep fascia, take note that it is in the anterior abdominal wall, which is a thin layer of connective tissue covering the muscles, and it lies immediately deep into the membranous layer of the superficial fascia. So after your membranous layer, it is under it is your deep fascia. Next is your transversalis fascia. So this is your transversalis fascia. So now, before your transversalis fascia, sorry, are the muscles right here. Sorry for the confusion. Again, after your deep fascia are the muscles. So we start off with your external oblique muscle, then the internal oblique muscle, and lastly, the transversus abdominis muscle. Next is the transversalis fascia. So you can find it right here after your transversus abdominis muscle. So this fascia is a component of an extensive thin layer of fascia that lies between the muscle layer of the abdominal wall and then the parietal peritoneum. Next is the extraperitoneal fascia, another yellow layer here. So it is a thin layer of connective tissue that contains a variable amount of fat. That's why, as you can see, it's mostly yellow. Not only a bit, but it is mostly yellow. So it lies between the transversalis fascia right here and then the parietal peritoneum, wherein the parietal peritoneum now or covers the outside layer of the abdominal organs. And lastly, we have the parietal peritoneum. So the deep sides of the walls of the abdomen are lined with parietal peritoneum. So take note that it is a thin serous membrane and it is continuous below with the parietal peritoneum lying our pelvis. So we will discuss about our pelvis on the last part of our midterms. Okay. Now, next part is the nerve supply. So in our anterior or anterolateral abdominal wall, we have the cutaneous nerve supply or sensory nerve supply. So it is actually from the lower five intercostal nerves, which come from or are derived from the anterior rami of the lower six thoracic nerves. For example, from the T12, T11, T10, T9, and T8. And also, it might include your T7. Next is the or are the iliohypogastric and then the ilioinguinal nerves. So these iliohypogastric and ilioinguinal nerves are or represent our first lumbar nerve. So as you can see here in the image, the abdomen will be supplied, especially in the sensory part of our abdomen, will be supplied by again the lower five intercostal nerves from the anterior rami of the lower six thoracic, and then your iliohypogastric here, and then the ilioinguinal nerve here. Now, next, for the dermatomal supply of our abdomen. So when we define dermatome, so it will be based by the level of the spinal nerves. So for T7 right here, it actually again, the dermatome of T7 spinal nerve is located in the epigastrium. So right here, epigastrium over the xiphoid process. Take note of that. Then we have here T10. So for T10 dermatome, it includes the umbilicus. As you can see, if you want to assess or in patients with spinal cord injury, and if you want to assess their sensory functions at the level of T10, you want to assess it at the umbilicus. Then for L1, it is just above the inguinal ligament right here. So again, your dermatome of L1 lies just above the inguinal ligament and of course at the symphysis pubis right here at the center. Next, we have the muscles of the abdominal wall. So generally, the anterolateral abdominal wall houses three broad and thin sheets of muscles that are most pronounced laterally and that become aponeurotic anteriorly. So they actually form aponeurosis or the connections of muscles. Okay, now we have here first the external oblique. So let's locate the external oblique. So as you can see, external, so outermost layer. So we have here your external oblique. So that's from superficial to deep. Next is your internal oblique right here. And then next we have the transversus abdominis. Lastly, the one nearer to the midline is your rectus abdominis. So we have here on the left and another here on the right. So take note that this rectus abdominis is the medial pair of muscles. As you can see, it's found medially compared to your external oblique, internal, and transversus abdominis that are mostly found laterally. Then it is your rectus abdominis. It is ensheathed by the aponeurosis of the lateral muscles, which don't come to the midline. Okay, so as you can see, we have here another structure we call as your inguinal ligament. So this one is your inguinal ligament on the right and then another one on the left. So you can find the inguinal ligament from the axis right here as what I am pointing through my laser pointer. This is your anterior superior iliac spine. So it is where your inguinal ligament starts up to the pubic symphysis right here. So It actually forms, or yes, it actually is formed by the lower border of your external oblique muscle right here, and rolls up on itself to form the inguinal ligament. So from external oblique muscle, it will roll up from the axis and then to the pubic symphysis and form the inguinal ligament. So here is another picture of our muscles of the abdominal wall. So as you can see here, we have the external oblique muscle and then the internal oblique. So as you can see, they have different muscle fibers, the direction of their muscle fibers. And then we have here the transversus muscle or transversus abdominis. So take note that the posterior border of the external oblique, as you can see, this is your anterior and this is your posterior. Its posterior border its posterior border is actually free. So they are not connected on both sides. On the other hand, we have here your posterior borders of the internal oblique and then the transversus muscles. So they are usually or mostly attached to the lumbar vertebrae by your lumbar fascia. So as you can see here in the image, your lumbar fascia is found posteriorly and they connect the posterior parts of your internal oblique muscle and then your transversus abdominis or transversus muscle. So let's talk about these muscles of the abdominal one by one. So we have here your external oblique. So as you can see, it is a broad, thin, muscular sheet with most of its fibers inserting by means of a wide aponeurosis. So this is a very wide aponeurosis, this white part on the anterior part of your abdomen. So your external oblique originates from the lower eight ribs right here, and then it actually inserts to the xiphoid process to the linea alba, which is found at the center of your abdomen, the iliac crest right here, as you can see here, and then the pubic tubercle right here, as what I am pointing in my list using my laser pointer, and of course the pubic crest. Okay, then actually we have here the table. So it is actually supplied by the lower six thoracic nerves, as what we have discussed earlier, and then the iliohypogastric, and then the ilioinguinal nerves. So take note that its action includes supporting the abdominal components, compresses the abdominal contents during flexion, and also it assists in flexing and rotation of the trunk. Aside from that, it assists in force expiration forced expiration, as what we have discussed in our prelim or micturition also. Next, we have here the internal oblique muscle, which are actually um, indicated by the lines here, the green one and then the yellow one. So in our internal oblique muscle, it is known as a broad and thin muscular sheet that also lies deep to the external oblique. Most of its fibers run at right angles to those of the external oblique and radiate as they pass upward and forward. So again, they actually pass upward and forward from here, upward and forward. So they originate at the lumbar fascia at the back here, iliac crest here, lateral two-thirds of the inguinal ligament. So this is the inguinal ligament. So the internal oblique muscle also originate from that structure only, but only at the lateral two-thirds, and then of course in the inguinal ligament itself. Okay, and then after their origin, we have their insertion. So they insert at the lower three ribs and the costal cartilages. Of course, the xiphoid process, and then the linea alba, again found at the center of the our abdomen, and the symphysis pubis right here. Okay, so we have here um, another table for the internal obliques. So they are supplied by the same nerves that supply your external oblique muscle. Okay. Next, for the action, they also have the same action as the external oblique. Next, we have here the transversus abdominis.